Hello, friends. We hope that you all are doing well and ready to learn something new with us. Today, we have come up with another important topic related to health, and it's about vitamin D. Why is it important to discuss? You will get it shortly in our video. Here is the outline of our topic. 1. What is vitamin D? 2. Why do kids need vitamin D? 3. Where does vitamin D come from? 4. How much vitamin D does a child need? 5. How can I help my child get enough vitamin D? 6. Vitamin D and calcium. 7. What does your diet have to do with getting enough vitamin D? 8. Vitamin D content of various foods. 9. How much vitamin D do you need? A generalized question and discussion for everyone, including adult and children. 10. What causes vitamin D deficiency? 11. What are the signs and symptoms of vitamin D deficiency? 12. How is a vitamin D deficiency diagnosed? 13. What do vitamin D test results mean? 14. How often do you need to get your vitamin D levels checked? So, let's start with: what is vitamin D? Vitamin D is a nutrient that helps the body take in calcium from the foods that we eat. Together, calcium and vitamin D build bones and keep them strong. Vitamin D also plays a part in heart health and fighting infection. Why do kids need vitamin D? Kids need vitamin D to build strong bones. Vitamin D also helps bones heal after an injury or surgery. Where does vitamin D come from? Our bodies make vitamin D when our skin is exposed to the sun. It's hard to get enough vitamin D from the sun, though. Most kids and adults spend lots of time indoors, at school, and work. When outdoors, it's important to protect skin, to prevent melanoma and skin damage from too much sun exposure. Very few foods have vitamin D naturally. The foods with the most are fatty fish and fish oils. Kids don't eat these foods a lot. That's why food companies add vitamin D to milk, yogurt, baby formula, juice, cereal, and other foods. Adding vitamin D to foods is called fortifying. It's helpful, but it still may not be enough. To get enough vitamin D, children often need to take a multivitamin with vitamin D or a vitamin D supplement. Vitamin D is sometimes labeled as vitamin D3. You can buy vitamin D pills, gummies, chewables, liquids, and sprays in stores without a prescription. Ask your child's healthcare provider for advice on choosing the right one. How much vitamin D does my child need? Vitamin D is measured in international units, or IU. Babies, younger than 1 year old, need 400 international units of vitamin D a day. Baby formula has 400 international units per liter, so babies who drink at least 32 ounces of formula each day get enough. If your baby takes only breast milk or gets less than 32 ounces of formula each day, ask your healthcare provider about giving your baby a vitamin D supplement. Kids older than 1 year need 600 international units or more of vitamin D a day. Healthcare providers often want healthy kids to take 600 to 1,000 international units daily. Some kids might need more vitamin D, such as those who have certain medical problems, for instance, obesity, celiac disease, cystic fibrosis, multiple fractures, or bone pain. Are healing from bone surgery, such as after fusion surgery for scoliosis. Are taking medicines, like anti-seizure medicines, that block the way the body uses vitamin D. Your healthcare provider can talk to you about whether your child needs a vitamin D supplement. How can I help my child get enough vitamin D? Because vitamin D is so important, you'll want to be sure your child gets enough. Giving your child a daily supplement, or a multivitamin with vitamin D, is the easiest way to do this. Healthcare providers might order a blood test if they think a health problem is keeping a child from getting enough vitamin D. If doctors don't think your child has a health problem, there's no need for a blood test. Vitamin D helps the body absorb calcium, which is a building block for strong bones. Unlike with vitamin D, kids usually can get enough calcium from food. High calcium foods include milk, cheese, and yogurt. Food makers often fortify foods, like cereal, bread, or juice with calcium. What does your diet have to do with getting enough vitamin D? Vitamin D doesn't occur naturally in many foods. That's why certain foods have added vitamin D. In fact, newer food nutrition labels show the amount of vitamin D contained in a particular food item. It may be difficult, especially for vegans or people who are lactose intolerant, to get enough vitamin D from their diets, which is why some people may choose to take supplements. It is always important to eat a variety of healthy foods from all food groups. According to health professionals, Dietary Supplement Fact Sheet of National Institutes of Health, Office of Dietary Supplements, August 7, 2019, various foods contain these vitamin D content in international units per serving. Cod liver oil contains 1,360 international units of vitamin D per tablespoon. 3 ounces of cooked swordfish provides 566 international units of vitamin D. 3 ounces of cooked sockeye salmon has about 447 international units of vitamin D. 3 ounces of tuna, canned in water and drained, contains 154 international units of vitamin D. 1 cup of orange juice, fortified with vitamin D, holds 137 international units of vitamin D. 1 cup of vitamin-fortified milk gives 115 to 124 international units of vitamin D. 6 ounces of yogurt, fortified with 20% of the daily value of vitamin D, offers 80 international units of vitamin D. 2 sardines, canned in oil and drained, contains 46 international units of vitamin D. 3 ounces of cooked beef liver provides 42 international units of vitamin D. 1 large egg yolk has around 41 international units of vitamin D. 1 cup of cereal, fortified with 10% of the daily value of vitamin D, gives 40 international units of vitamin D. 1 ounce of Swiss cheese holds 6 international units of vitamin D. It is important to check product labels, as the amount of added vitamin D varies when it is artificially added to products, such as orange juice, yogurt, and margarine. How much vitamin D do you need? It is a generalized question and demands discussion for everyone, including adult and children. In healthy people, the amount of vitamin D needed per day varies by age. Let's discuss often cited recommendations of the Institute of Medicine, now the Health and Medicine Division of the National Academies of Sciences, Engineering, and Medicine. It is important to know that these are general recommendations. If your doctor is checking your blood levels, he or she might recommend higher or lower doses based on your individual needs. The recommended dietary allowance of vitamin D is 400 international units per day for babies from newborn to 6 months old, but avoid giving them more than 1,000 international units per day, as it is considered the safe upper limit. For infants of 6 to 12 months of age, the recommended dietary allowance of vitamin D is 400 international units per day, while the tolerable upper intake level is 1,500 international units per day. The recommended dietary allowance of vitamin D for children of 1 to 3 years of age is 600 international units per day, and parents need to calculate the amount of vitamin D their child gets from fortified milk, other food, and vitamin supplements to make sure the total amount does not exceed 2,500 international units per day. Children aged 4 to 8 years need 600 international units of vitamin D each day, whereas the upper level intake is 3,000 international units per day. In order to meet the dietary requirements of people aged 9 to 70 years, the daily dietary allowance of 600 international units is recommended, and the upper level intake for them is 4,000 units per day. To help meet vitamin D requirement of people over 70 years old, a daily dietary allowance of 800 international units is recommended. The tolerable upper intake level for this age group is 4,000 international units per day. Pregnant and lactating women of age 14 to 50 years are advised to take 600 international units of vitamin D each day, with tolerable upper intake level of 4,000 international units per day. If you have osteoporosis, your doctor might suggest a blood test of your vitamin D levels. The amount of vitamin D supplement can be customized for each person based on the results. For many older patients, a vitamin D supplement containing anywhere between 800 to 2,000 international units daily, which can be obtained without a prescription, can be both safe and beneficial. It is important to speak with your doctor about your individual needs. What causes vitamin D deficiency? Vitamin D deficiency can be caused by specific medical conditions, such as cystic fibrosis, Crohn's disease, and celiac disease. These diseases do not allow the intestines to absorb enough vitamin D through supplements. Weight loss surgeries that reduce the size of the stomach and/or bypasses part of the small intestines make it very difficult to consume sufficient quantities of certain nutrients, vitamins, and minerals. These individuals need to be carefully monitored by their doctors and need to continue to take vitamin D and other supplements throughout their lives. A body mass index greater than 30 is associated with lower vitamin D levels. Fat cells keep vitamin D isolated so that it is not released. Vitamin D deficiency is more likely in obese people. Obesity often makes it necessary to take larger doses of vitamin D supplements in order to reach and maintain normal D levels. Kidney and liver diseases reduce the amount of an enzyme needed to change vitamin D to a form that is used in the body. Lack of this enzyme leads to an inadequate level of active vitamin D in the body. What other factors can lead to vitamin D deficiency? The skin's ability to make vitamin D lessens with age. People who are homebound or are rarely outside, for example, people in nursing homes and other facilities, are not able to use sun exposure as a source of vitamin D. Dark-colored skin is less able to make vitamin D than fair-colored skin. A woman's breast milk only contains a small amount of vitamin D. Often infant formulas only include a small amount of vitamin D also. Therefore, infants are at risk of not receiving enough vitamin D. This is especially true for infants who are only fed breast milk. Can medications cause a vitamin D deficiency? Yes. Vitamin D levels can be lowered by certain medications. These include laxatives, steroids, such as prednisone, cholesterol-lowering drugs, such as cholestyramine and cholestyramine, seizure control drugs, such as phenobarbital and phenytoin, a tuberculosis drug, rifampin, a weight loss drug, orlistat. Always tell your doctor about the drugs you take and any vitamin D supplements, or other supplements, or herbs, or alternative health products that you take. What are the signs and symptoms of vitamin D deficiency? Severe lack of vitamin D causes rickets, which shows up in children as incorrect growth patterns, weakness in muscles, pain in bones, and deformities in joints. This is very rare. However, children who are deficient in vitamin D can also have muscle weakness, or sore and painful muscles. Lack of vitamin D is not quite as obvious in adults. Signs and symptoms might include fatigue, bone pain, muscle weakness, muscle aches or muscle cramps, and mood changes, like depression. How is a vitamin D deficiency diagnosed? Your doctor can order a blood test to measure your levels of vitamin D. There are two types of tests that might be ordered, but the most common is the 25-hydroxyvitamin D, known as 25-OH-D for short. For the blood test, a technician will use a needle to take blood from a vein. You do not need to fast or otherwise prepare for this type of test. What do vitamin D test results mean? There are some differing opinions about what levels of vitamin D work the best for each person. Laboratories might use different numbers for reference. Please discuss your results with your doctor. How often do you need to get your vitamin D levels checked? Doctors do not usually order routine checks of vitamin D levels, but they might need to check your levels if you have certain medical conditions or risk factors for vitamin D deficiency. Sometimes vitamin D levels can be checked as a cause of symptoms, such as long-lasting body aches, a history of falls or bone fractures without significant trauma. So that's all for today. We really hope that you like this video about vitamin D. Being pharmacist moms, our motto is, never stick to our profession only, but we always try our best to come up with generalized health topics, those mean to be helpful, and learning for everyone and for every profession. Help us to grow this channel with your friends and family. Thank you, and take care.